More now in our top story. All of Ontario will be going back into what the provincial government calls lockdown measures. Multiple sources tell CBC News the Premier Doug Ford will be making the announcement today in Toronto. The new restrictions will take effect Saturday and will last for 28 days. Sources add that those province-wide restrictions will be essentially the same as what is now in effect in the Toronto area, Hamilton, Sudbury and Thunder Bay. Stores open at reduced capacity, but indoor dining, gyms and salons shut down. The new lockdown measures follow a surge in COVID-19 patients in Ontario ICUs. Critical Care Services Ontario says right now 421 people are in ICU with the virus. That's more than at any time during the pandemic. This ICU nurse says the situation is scary.
We're seeing younger and younger patients coming nowadays compared to the first and second wave. And also the nurse-patient ratio is becoming more and more unsafe. Normally in ICU, when a patient is so sick, you have one nurse to look after the patient, sometimes two, depends on how sick they are. But now we're starting to see 2 patients to 1 nurse, even 3 patients sometimes. So it's really getting scary.
So for more on this now, I'm joined by Dr. Jamie Spiegelman. He's an internal medicine and critical care specialist at Humber River Hospital in Toronto, and he joins us now live from Toronto. Dr. Spiegelman, thanks for your time once again.
Thanks for having me again, too.
Let's talk about this. Start with your reaction to those record high ICU numbers.
Yeah, I think that's definitely what we're seeing day by day. We're definitely increasing the number of these patients. Over the last day or so, there were another 30 people in Ontario admitted in Ontario hospitals to ICUs, and about 8 of them were at our hospital. So it does feel like we're boiling water in a pot and it's about to boil over at this point.
If it were to boil over, what does that look like for you on the front lines?
Well, it means that we're treating patients outside of the main ICU. It means that we don't have nurses to take care of them in the fashion that we want to take care of them. We'll obviously take care of them. There's no question that we're going to take care of every patient that comes into our hospital. And hopefully other hospitals have space, so we continue to send these patients to other hospitals if they do have space. From what I understand, those spaces are running out at other hospitals as well.
I appreciate that you say they will be cared for, but we heard the warning from that nurse, and we know that there is an acceptable ratio of patient to nurse, patient to orderly, doctor attention, ability to maintain contact with families at this crucial time, all of that. There must be an effect as those numbers go up in terms of the overall ability to treat these patients.
There is and there isn't. I think healthcare providers, nurses, doctors will go above and beyond and not take their breaks and not and take care of patients. Definitely, there is less nurses right now per patient. There's no question about that. There's a nursing shortage for critical care units in the province, and every hospital has the same problem. I don't think there's a doctor issue right now. Doctors will take care of patients no matter what, and will go in above and beyond, not take breaks, not move away from the ICU unless the patient's stable. So there is a manpower issue for sure, taking care of these patients. And if we have to take care of them in the emergency room or not in ICU settings, we'll take care of them. I don't think healthcare providers, nurses, doctors, orderlies, anyone in the healthcare team is going to give up on these patients.
Fair enough. And all of you, of course, admirable for feeling that way. But does it not have some emotional effect on you as this now goes into another year?
It does. I mean, from a personal standpoint, when we're intubating somebody who's younger than myself, obviously it's very different than intubating somebody that's my grandparents' age. So, and that's what we're seeing more and more. We're definitely seeing a younger population coming into the ICU. The youngest person I admitted in the last couple of days was a 22-year-old female coming in with really, really bad COVID-19 pneumonia, and like it's somebody who's basically half my age getting intubated. So it does have an emotional toll when you're doing that, I think.
Ontario Premier Doug Ford expected to make an announcement today to tighten the restrictions across this province. How effective do you think that can be at this point? Could it be too late?
Yeah, I mean, we've been more reactive than proactive in general, but I think we have to act now, and I think making that decision today, not an April Fool's joke, it is a real thing that they should be making it today for sure.
let's look ahead, because we have a holiday weekend upon us. We already have the numbers on the rise. What is your biggest fear about what the next 2 to 4 weeks may hold for hospitals in Ontario?
Yeah, capacity issues are obviously the problem. I've always said that lockdown should happen when the hospital system can't handle it, and we're getting to that point, that boiling point where we can't handle it. So I think the next month is very key for hospitals to be able to handle it, especially with Passover, Easter, and Ramadan coming up. We're all concerned from families getting together and a lot of people getting together and spreading it. So I think lockdowns are the only solution at this point. And is it too late? I don't think so. I think we could handle it as of now. So if it doesn't become a bigger problem, I think the healthcare system can handle it in the next month.
Fair enough. And I don't want to sensationalize this at all, but people clearly are not listening to the warnings in some cases, and we're seeing those numbers go up. You mentioned a boiling point. If it boils over, what does it look like?
It's hard to say. Like I said, I think healthcare providers are going to go above and beyond to take care of people. It is definitely growing at this point in terms of number of patients with COVID and coming into hospital and getting in the ICU. We're just going to have to adapt, and there's no other choice, right? This is life.
When people are gathering at those so many cherished religious holidays over the next few weeks, we've heard the warnings again, but finally, let me just leave you with the last word. What should people do?
Yeah. I think at this point, you have to realize what you're doing to your family members and loved ones. I think you have to realize that this is spreading and it's very contagious, and you don't want to put your loved ones at risk, including your family, your parents, especially elder people, but also younger people. So I think we have to continue taking the precautions needed in terms of wearing masks, keeping social distancing, and not getting together. And getting together virtually is probably the best way right now.
Your story about the 22-year-old being intubated does get the message through about it really is hitting young people in unprecedented ways.
Yeah.
Dr. Spiegelman, I want to thank you so much for your time. Really appreciate it.
Thanks a lot.
Stay healthy.
Bye.
Dr. Jamie Spiegelman is an internal medicine and critical care specialist at Humber River Hospital in Toronto.